Okay. Hi, my name is Alona. I'm a nursing student. I'm an NP student with Saginaw Valley University. I'll be performing the respiratory exam today.
Great.
Okay, so have you had any shortness of breath, coughing, or anything like that?
No, I don't think so.
No? Okay. Have you had any respiratory infections?
I don't know.
No?
No.
Any chest pain?
No.
No? Okay, good. So first I'll start out with inspection. I'm looking at her chest. I don't see any deformities. I don't see any accessory muscle use. Trachea looks midline. There's no deviation there. I did count her respiratory rate before starting. It is 15 breaths per minute, which is unremarkable. The rhythm is regular. I don't see any intercostal retractions on inspiration. So I'm going to go ahead and palpate your trachea here. Trachea is midline. I'm going to go ahead and come around from the back and go ahead and take big breaths for me. Okay, relax. And then just regular breathing. I don't know any accessory muscle use. I don't hear any audible wheezing. Next I'm going to evaluate your chest expansion. Go ahead and take a good breath in. Breathe out. One more time. Okay, go ahead and turn. I'll be doing the same thing in the back here. Go ahead and take a good breath in. One more time. Okay, so chest expansion is symmetric on both sides, anteriorly and posteriorly. So next, since we're at the back here, I will be asking you if you have any pain or tenderness. So just let me know, pain or tenderness. Pain or tenderness?
No.
Pain or tenderness?
No.
Pain or tenderness?
No.
Okay, great. So next we're gonna go ahead and proceed on to the tactile firmness test. So you will have to say 99 when I tell you so. Go ahead and say 99.
99.
Go ahead.
99.
Go ahead.
99.
Go ahead.
99.
Go ahead.
99.
Okay, so tactile firmness is bilaterally equal posteriorly. Go ahead and turn for me, please. Same thing. I'm gonna ask if any pain or tenderness. Pain or tenderness?
No.
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 Okay. Same thing. I'm gonna ask you to say 99. Okay. Go ahead. 99.
99.
99.
99. 99. 99. 99. 99.
Okay, so tactile firmness is bilateral equal on both sides. I can feel the vibrations the same equally. So next we're gonna go ahead and turn. So I'm gonna be focusing on your back. Here, we're gonna start with percussion. So what I'm gonna do is start at the left lobe, the apex of the lungs, move laterally down to the bases of the lungs. So I'm gonna find the intercostal space here. Okay, so the percussion part is complete. What I heard was resonance throughout the lung fields on both sides, which is an unremarkable finding. Next, I'm gonna perform the diaphragmatic excursion exam. So what I'm gonna do is have you exhale. So take a breath, exhale, and then hold your breath when I say so, okay? So just make sure to hold your breath. So I'm gonna start out under the scapula here, and then I'm gonna percuss down. So go ahead, exhale, hold your exhale, hold your breath. So I heard, so I went from resonance sound to a dull sound, which is about here. So I started about here. The normal findings is about 3 to 5 centimeters. So next I'm gonna have you inhale. So take a breath in and hold. Okay, perfect. So I'm just gonna, same thing, perform the same. So I'm hearing dullness just about here. So from here to here, 3 to 5 centimeters is a normal finding. And I would perform the same thing, and you could breathe now. I would perform the same test on this side for the diaphragmatic excursion. So I'll do it bilaterally. Okay, perfect. So next we're gonna move on to auscultation. So again, I'll start at the apex of the lungs of the left lobe and then move laterally down to the bases. So take good breaths in for me when you feel my stethoscope touch. Normal breathing, but good breaths. Go ahead. Breathe. Okay, you can breathe normal now. Vesicular sounds were heard bilaterally on both lung fields. So next we're gonna go ahead and lie on your back here, please. We'll be doing the interior portion of the exam. I will turn the camera so we can see better. Okay, so inspecting the thorax here, again, I don't see any deviations or any deformities that I can see, so I'll go ahead and proceed on. So first we're gonna go ahead and percuss. Again, I'm gonna move just below the scapula here, or the clavicle here, move laterally down to the bases. Okay, so that completes the percussion. Again, the resonance was heard over the lung fields. I'm gonna go ahead and auscultate. I'm gonna go same lateral down, just below the apex down to the bases. Take good breaths for me. Okay, upon auscultation, vesicular sounds were heard over both lung fields, which is unremarkable. If I didn't hear any adventitious lung sounds. If I did hear any, I would perform the post-tussive auscultation where the patient coughs, and I would listen the same spots I did just now with the assessment. As well, I would do the voice transmission test, where I will have the patient say 99 while I auscultate down to the lung fields on both sides, as well as saying E, E, E. Same thing, I would auscultate down, as well as whispering 1, 2, 3. Auscultating then. So what I normal finding would be a sound that it's muffled, nor like a low-pitched sound coming through. You don't want any high-pitched sounds, meaning that there might be some fluid there in the lungs. So that will conclude our exam. I did not note the color, I believe, so I will say that the color, I'm looking at the fingernails here, there's no cyanosis, and as well as looking at the general appearance, there's no cyanosis present. And that will conclude the exam. So lung sounds were vesicular, breath sounds, resonance was present upon percussion, and I didn't see any signs of distress, respiratory distress upon inspection. So thank you.